I think it's incumbent upon us in healthcare to make sure that we never lose track of what's most important, which is the human connection. At the end of the day, we're serving people, and we're serving people in their most challenging times, their times with the most anxiety, and we can't detract from the care that we have to deliver to them. So whether we're adapting with telehealth so that we can provide care into the community where people can't get it, or whether we're providing telehealth services to patients at the bedside so they can be with their family members when they can't be in person. We have to keep in mind why we're here, which is that we're serving people. We're serving people in the worst part of their lives. We're serving people when they have incredible anxiety, and it's our responsibility to continue to be compassionate, to be empathetic when we're trying to adapt our services.
Yeah, I am learning so much as all of you are speaking. At Very Well Health, we pride ourselves on providing accurate information, but is also very trustworthy for people who are looking for information in a time of need. So that agility and that adaptation that you were just speaking of, Dr. Molino, I have seen in so many different ways through this pandemic. But I think that all of us have an equal responsibility into how we can shape that response. For all of you, I wanted to ask you this specific question. When we look at this pandemic and really how it has shaped human response, right, to crisis information, this has been very a crisis mode for a lot of different people in various different ways. I think everyone has kind of had their collective experiences through this pandemic that has played out very differently for everybody. How do you think in the hospital setting or, in a healthcare setting that has shaped the human response to crisis information? And that's for all of you to take a stab at that.
Well, I'll kick it off and just say that there were things that were really stressing as we've been talking about during this pandemic. But taking a step back, you look at a lot of the things that were stressing were present before the pandemic and just amplified by the pandemic. And so we take a view of, in the mid-century, what are our pre-competitive needs that we have now? And what I mean by pre-competitive is that, what needs exist that if they aren't fixed, it doesn't matter what health system we have mid-century, it's not going to work very well. And those pre-competitive needs shape our strategic thinking. And they include better thinking and around chronic disease and care for chronic disease. 100 million people now in this country have chronic disease of some sort. It accounts for 90% of the $4 trillion health care spend. And it's now probably even more with long haul and other consequences of COVID-19. We need to understand and do better in chronic disease. I mentioned before data liquidity, that, along with chronic disease, you need to have good organization of actionable data longitudinally throughout patients, the interaction with the healthcare system. A third is training the physician workforce for the 21st, not the 20th century anymore. A third pillar in medical education, health system science, and talks about team-based work, the knowledge and cultural competency that physicians need to deal with our diverse population, the data analytics that are needed. Another example is sort of getting rid of the needless regulatory work and the kind of work that allows physicians to only spend an hour out of 3 face-to-face with the patients when both physicians and patients put that time together. And then lastly, this was really pointed out in detail by the pandemic, is to root out racism, both inside the halls of medicine and medical care and outside. We aspire to high quality care and safety, but if we have populations that have very different kinds of health inequities, that's a glass ceiling on how well we can do as a nation in our healthcare. So I think these 5 or 6 things are pre-competitive needs that pointed out by the pandemic, pre-existed before the pandemic, And if we don't fix these, no matter what health system we have, it's not going to work as well as it should for patients.
I think that is so important that you mentioned that unless we really pay attention to and fix those things, it really doesn't matter what type of healthcare system that we have. Jesus, what would you say is that disconnect throughout these last 18 months that you found have maybe 3 tips that you could give to help reestablish the connection with people when we think of emotional connectivity and mental well-being?
Great question. I think a lot of us have had a diminished and some folks even an eliminated access to connection with other people face to face. I will say that technology has allowed us to connect with others in such a meaningful way, piggybacking off of something Dr. Madera said about regulations and how this, I think, holds back providers from doing what we were meant to do, which is to provide help, to provide services. And we're seeing it in the mental health space too, with really state licenses. Even though we have the technology in front of us, we are barred from making matches for clients and therapists because of not being licensed in the right state. So, bringing it back to your question of how to maintain connection, how to continue to achieve emotional wellness when it comes to context of being with other people, use technology. If it's not safe for you and if it doesn't make sense for you to get into big groups, to connect with other people, to create meaningful experiences and memories in person, we have this thing right in front of us that allows us to connect. And if people are thinking, I can't really replace a face-to-face interaction through something on my smartphone or on my computer, it's not as personable, it doesn't seem like real life, I'm going to tell you now, people are finding their spouses, their life partners online. People are making huge decisions like closing on a house, going into escrow, all doing it digitally, never coming face-to-face with a broker, any kind of real estate agent. We are educating our children. We're trusting that our educators are going to be able to effectively teach our kids how to read, how to do math. So really tune into what you have as access for technology. And, technology, there's double-edged sword here. I think it allows us to connect. It allows us to create community. It allows us to organize. But it also can be responsible for the spreading of misinformation. It can also be used to create a vacuum of knowledge in which people can reject ideas that don't line up with their own beliefs. So it's being mindful, as always, of being in tune with what's available to you, what you have access to, and making it work for you in a meaningful way. And I think we can continue to do that with other people, even if we can't see each other.